Hi, this is Patty Corbett Ward, and I would like to welcome you to this presentation of Learning Thursdays. As a reminder, Learning Thursdays is an educational series which is offered to addiction professionals as a free learning opportunity as a way to enhance and develop their competencies in the substance use disorder treatment field. When I talk about a competency, I talk about knowledge, skills, and attitudes that a person needs in order to master a specific task they are assigned to do. And we do this as a way to enhance the program for folks who come to us, be it for treatment, prevention, or recovery. That being said, I would like to introduce you to the presentation you will be viewing now, which is entitled Meeting the Needs of Justice-Involved Veterans, Expanding Knowledge on Veterans. This being November, we always try to offer you information specific to a population that oftentimes has been underserved. In a moment, you will meet the presenters, and that will include Paul Noonan from our own OASAS. He is our Veterans Liaison, as well as Courtney Slade and Jonathan Pollock. Paul will do the honor of introducing Courtney and Jonathan, and in a moment, I will introduce you to Paul. I just want to remind you that if you ever have questions, feel free to send them to us at learningthurs@oasas.ny.gov. And I can assure you within a day or two of them arriving in the mailbox, you will get an answer from one of our staff. So again, I would like to hand this over to Paul Noonan, and he will do a little introduction to the bigger presentation. So thank you for joining us. And Paul, welcome and thank you.
Hi everybody, this is Paul Noonan, the OASAS Coordinator of Veterans Services. Welcome to another Learning Thursdays. Today, it being in the month of November, we are talking about the issues related to veterans involved with the justice system. And meeting the needs of justice-involved veterans is the more formal title of our program today. I'd like to welcome our two guests who are going to give you a lot of valuable information about a unique program provided by the VA here in New York State. I've always said that I'm very fortunate to have people from the Veterans Administration be partners of mine and partners of OASAS in this effort. They're always very helpful and very knowledgeable, and our two guests today certainly meet that description. With me today are Courtney Slade. Courtney is an LCSW. She is the coordinator, the Veterans Justice Outreach Coordinator, working out of the Stratton VA Medical Center located right here in Albany. Courtney is primarily responsible for an area that's roughly the size of our very own northeast region of OASAS. With Courtney is her VA colleague, Jonathan Pollock, who is responsible for the Veteran Healthcare Reentry Program operated by the VA, also here in upstate New York, but Jonathan represents a larger geographic area, which is, he tells me, is the upper right-hand quadrant of New York State, a little bit bigger than our northeast region, in a sizable area. In fact, both of these people deal with a sizable area of responsibility as well as geographic area. So they're here to tell you about the VA's work with justice-involved veterans. It's no secret the trauma of combat exposure and the rigors of military life in general can often trigger behavior problems back here in civilian life. In fact, reintegration into civilian life is often very difficult for a newly returned veteran who's coming back after an overseas deployment, particularly those exposed to combat. They often run afoul of the criminal justice system, as well as the state and local correctional systems as well. So the VA has some very helpful, very targeted, very focused, comprehensive programs devoted to working with the systems and the veterans themselves to minimize the negative impact of their involvement and help them get on the straight and narrow, if you will. So without further ado, I'd like to introduce our first speaker, who will be Courtney Slave, Veterans Justice Outreach Coordinator for the Albany Stratton VA.
Thank you so much, Paul. We're really excited to provide this training today and eager for the collaboration with New York State, OASAS, and the clinicians that will be watching the presentation when it airs. To start, though, we'd like to take a moment to thank any of the veterans that might be sitting and observing this training today, active service members, family of veterans and active service members, before we get started. Our agenda is going to focus on an overview of the Department of Veteran Affairs. Our programs are very unique in that we provide services to a very specific population within the veteran population. So we thought it best to provide a foundation of the overall services that the Department of Veteran Affairs provides. Also going into more specifically the Veterans Health Administration, where Jonathan and I are embedded in the services that we work with. So we're going to provide that at the beginning, and then at the tail end, I will cover the Veterans Justice Outreach Program, which will commonly refer to as the VJO program, and then Jonathan will cover the Healthcare for Reentry Program, or HCRV, as we might reference it today. So the VA mission is to fulfill President Lincoln's promise to care for him who shall have borne the battle, and for his widow and his orphan, by serving and honoring the men and women who are America's veterans. Vision would be to provide veterans the world-class benefits and services they have earned, and to do so by adhering to the highest standards of compassion, commitment, excellence, professionalism, integrity, accountability, and stewardship.
The Department of Veterans Affairs is divided into three parts. The Veterans Benefits Administration deals with just the way it sounds, with veterans benefits. The Veterans Health Administration, which is the largest part of the VA, which is where we're basically from, and the National Cemetery Administration, which is the smallest sector of the VA. I'm going to talk a little bit about the National Cemetery Administration. The mission of the National Cemetery Administration is to honor veterans with final resting places in national shrines and with lasting tributes that commemorate their service to our nation. There are 3.1 million grave sites in the United States in the National Cemetery Administration and 131 national cemeteries, as well as 33 soldiers' monument sites. Burial benefits include headstone markers, burial flags, and a presidential memorial certificate. Eligibility for a burial in a national cemetery includes a service member who died on active duty, a veteran who was discharged under conditions other than dishonorable, or a reserve National Guard member who is entitled to retirement pay. If you are interested in the National Cemetery Administration information, you would contact the National Cemetery Scheduling Office, and the information is listed. You fax all discharge documentation as well as a follow-up phone call. To locate a national cemetery, you would use the following website. And any additional information about the national cemeteries would be included on the website below. Veterans Benefits Administration, they administer programs that provide financial and other forms of assistance to veterans, their dependents, and survivors. Benefits might include veterans' compensation, a veterans' pension, survivors' benefits, vocational rehabilitation and employment assistance, educational assistance, home loan guarantees, such as VA home loan, and life insurance.
There are two additional benefits within the Veteran Benefits Administration, monetary benefits, one being disability compensation and the other pension. Disability compensation comes as a tax-free payment to veterans on a monthly basis and is related to a disability they experienced or endured during their time in service. So it would be considered service connection is what we call it at the VA. And the veteran will receive monthly payment regarding that injury. It could be physical, mental health related, emotional experience. Pension comes as a tax-free payment as well, and is for wartime veterans with limited or no income who are either ages 65 or older or permanently and totally disabled.
Some other types of benefits would include education and training benefits, and that would be the post-9/11 GI Bill, which would include financial assistance, tuition and fees, books, supplies, and housing allowance, as well as the Montgomery GI Bill. It also includes reserve educational assistance programs. Home loans are also another type of benefit. The VA issued home loans with no down payment or mortgage insurance premiums needed, guaranteed loans through private lenders, and home loan refinancing. This includes specially adapted housing grants for severely disabled veterans. Other benefits include life insurance, vocational rehabilitation and employment, and that can include veterans with service-connected disabilities, and also providing career path evaluation, vocational counseling, and job search assistance. Further benefits include benefits for dependents and survivors. This would include dependency and indemnity compensation, which includes monthly benefits paid to surviving spouses or children. Eligibility would include being a service member, having a service member who died on active duty from a service-connected disability or was rated totally disabled at the time of death. Another type of benefit is a survivor's pension, which is a monthly tax-free benefit payable to the unremarried surviving spouse and/or children of a deceased veteran with wartime service who meet the income threshold. Surviving spouses and children are also eligible for reimbursement of medical costs, financial assistance and also financial assistance to pursue education and training.
E-Benefits is a great resource for veterans. Jonathan and I are often in facilities, correctional facilities, working with veterans. So we are often encouraging veterans, educating them to apply for benefits, enroll in health care, getting them started in the VA system. Many veterans that you're working with might already work with a Veteran Benefits Administration employee, a veterans organization advocate in the community, or a county veteran service officer who commonly advocates for benefits for veterans within the community setting. Veterans can apply for benefits online at ebenefits.va.gov, and at times we're able to even bring in our computers into the facilities, mostly made within the county jails, not so much for Jonathan in the prison setting, but we've enrolled veterans directly from the jail setting, which has been great. We can do that through paper as well, but if a veteran is not incarcerated, commonly they will sometimes go to the VA and enroll. They'll enroll by phone. And they can go to one of the accredited VSOs, attorneys, or a claims agent. We will always defer to the subject matter experts when it comes to veteran benefits. We are a resource and we're providing an overview today, but we will typically default to those who are trained specifically in this area.
Can I ask a question? Mm-hmm. Just so there's no confusion out there with our audience, mm-hmm. What is a VSO? Just so they know.
Veteran Service Officer.
Okay.
Yes. So that is someone who is hired by the county and provides a myriad of resources to the county veterans that live within that jurisdiction. They commonly help with National Cemetery Administration resources, VBA claims benefits. They will direct a veteran sometimes to the VA if they feel that they would benefit from health care.
Okay.
They tend to have much smaller caseloads than the benefits counselors that are the federal benefits counselors, so they can do provide more individualized attention.
Okay, and they can probably be found within the county's Veterans Bureau or... Mm-hmm. Okay,
yes.
Thank you.
Yes. So the Veterans Health Administration mission, VHA, as we'll commonly refer to it, is to honor America's veterans by providing exceptional health care that improves their health and well-being. The VHA system covers a myriad of services. Commonly, in a community, private sector hospital, you won't find homeless services. The VA provides homeless services, vocational services, as some of the unique services within that system. This is a map for reference just to show the breakdown of our healthcare system. We're broken up into regions. Our regions are called Veterans Integrated Service Networks, or VISNs. There are 21 of them throughout the country. Locally, within the VISNs, as we mentioned, there are a variety of medical centers, larger medical centers, community-based outpatient clinics, or CBOCs as we sometimes refer to, and there are over 1,400 total sites. There is an affiliation between the VHA and over 107 academic health systems, commonly training U.S. physicians across the country. If you are working with a veteran, or you have a family member who's a veteran or an active service member, and you're looking for your nearest medical center, a great resource would be to utilize this web link right here. The healthcare delivery model for the VA is patient-centered. The veteran has a say in the care that he or she is provided. We're veteran-centric. Team care. We utilize interdisciplinary teams in providing treatment, much like the community does as well. Continuous improvement focuses on evaluations, both regarding quantitative measures as well as qualitative measures. We're data-driven and evidence-based. We implement surveys to evaluate the care that we're provided veterans. We're evidence-based in that our treatment that we provide is all evidence-based and supported, much like the community sector as well. We focus on value and prevention, along with focusing on the veteran's take on his or her care. There was research done by the National Quality Healthcare Center that showed veterans rate VA healthcare as high or higher than others rate their healthcare. Reaching rural veterans. 43% of the veterans that we serve live in rural areas. Many steps have been taken to meet the need for healthcare access for rural veterans. In covering 18 counties, I cover from the base of Ulster County all the way up until we get to the Canadian border with Clinton and Franklin counties. So there's a lot of rural territory within that catchment area. The way that VA nationally has tried to implement more access to care for this population is through fee-basis care, or you might hear about VA Choice, which I won't get into details, but that is an opportunity for veterans to receive care in the community if they live a certain distance away from a larger medical center or a community-based outpatient clinic. We partner with a lot of community agencies to meet the needs of veterans, providing a collaboration of care. We also do mobile health clinics at times. There's a vet center mobile outreach RV that you'll see in the picture in the middle. Home-based telehealth is very unique, and the VA has been very progressive in this area. We utilize in-home actual Skype-like encrypted Skype care to veterans who are in need of, at times, medical services for evaluation and also mental health care, so therapy. I have an example for you to look at. It's my desk. It's my computer area, but this is where we can provide interventions to veterans who might be in their home or might be visiting a community-based outpatient clinic, say, in the northern Adirondacks or closer to the Canadian border. We call it VA Video Connect and Clinical Video Telehealth. We have a lot of acronyms within the VA system. But pretty much, this is encrypted Skype, and it allows for us to access veterans who might not otherwise seek care or might not be able to seek care as easily as some of our other veterans do. An example of this would be outreach that I provide to the Clinton County Jail. I send an email, very simple email, and it has a link in it. and the provider on the other end accepts it, and we're able to do quick visits or longer visits if needed with veterans who are incarcerated. And I'll go into greater detail throughout the presentation around what services we provide within our programs.
Helping homeless veterans. The VA's major homeless programs constitute the largest integrated network of homeless assistance programs in the country, offering a wide array of services to help veterans recover from homelessness and live as self-sufficiently and independently as possible. These include prevention services, housing and supportive services, treatment, employment, income, and benefit assistance, outreach and education, and community partnerships. The VA service continuum, treatment as a justice system alternative. This includes medical services, homeless program services, mental health services, addiction services, and specialty care.
Medical services are provided by the larger VA system, as we've mentioned. We include general medical clinics, primary care services, all the way to specialty care, surgery, medication management, health education, and as mentioned before, the telehealth services. The Albany VA Medical Center and Jonathan's coverage area are located within the New York, New Jersey VA Healthcare Network, or VISN 2. This network consists of VA facilities throughout New York, New Jersey, and Pennsylvania, serving over 500,000 veterans in 76 counties. As you'll see by the map, the maroon-colored locations are our larger medical centers, and as you go beyond them, you'll see the black-colored facilities, which are our community-based outpatient clinics. Storefront, primary care offices predominantly, but also providing telehealth services to other locations, possibly within our network, sometimes outside of our network, depending on the specialties that we have. We've had veterans who went to a clinic up north who were met with a provider out of Colorado. So we really have a lot of flexibility with that telehealth component. Down south, you'll see the same outline as well within the lower Hudson Valley region and Long Island, as well as New Jersey. So we cover a lot of territory, recently combining our networks to be the New York, New Jersey VA Healthcare Network.
Homelessness services include outpatient and immediate needs, and this would include, and this is called HCHV, which stands for Healthcare for Homeless Veterans. Residential and aftercare programming. A domiciliary is unique to the VA. Basically what they are is inpatient beds that include a residential placement. It is not housing on an outpatient basis. It's considered an inpatient bed, and they're shorter or longer term placements for veterans that may need more than a traditional hospital stay, say 30 to 45 days worth of treatment. And then they also include housing services. This can include emergency housing services, transitional housing services, also known as grant and per diem housing, and permanent housing, which can include Section 8, also known as HUD-VASH Section 8. Emergency housing includes contract housing. That would be basically set up for veterans that would not necessarily want to go to a general population shelter. It would just be veteran-exclusive housing. It could also include CWT transitional residence, grant and per diem, or again, transitional housing, and HUD-VASH would be permanent housing. Supportive services for veterans' families is also included with the homeless program. And this is called SSVF, another VA acronym. And VA grants include VA grants to nonprofits or consumer cooperatives. And criteria for veterans' families would include low-income families or families that are living and transitioning or transitioning to permanent housing.
So an example of this would be at times we have veterans who are seeking permanent housing and would be going into an apartment utilizing their HUD-VASH voucher. The SSVF services commonly are paired in that way so that they can get first month's rent and security deposit and also utilize the voucher moving forward. So it's kind of like puzzle pieces in many cases. And being that I work on the homeless program with my colleagues in grant and per diem and contract housing, we commonly try to pair the two. And at times we can even do that on the way out of someone being released from jail. Just like medical services, the VA provides a continuum of care in terms of mental health services as well. So outpatient clinics within the local medical centers, as visualized earlier, that was a photo of our Albany VA Medical Center, but also within community-based outpatient clinics. So we have mental health providers, oftentimes social workers, but sometimes psychologists who provide brief interventions and supportive therapy to veterans in CBOCs. Day programs, PTSD, which can range from outpatient to residential, also including vet centers, which I'll talk about in just a moment. We also provide acute psychiatric care. We have inpatient beds that are devoted to high acuity for veterans who might need an inpatient admission. So just like a community hospital, we can admit veterans to an inpatient unit for stabilization, medication management, and coordination of care for outpatient treatment once they're discharged. Mental health services, we provide a broad range of mental health services specific to the veteran's needs, veteran-centric, as mentioned earlier. That can include medication management, skill building and psychoeducational groups. We have very specific groups. We might have more psychoeducational groups, drop-in groups that veterans can come in and out of depending on their needs. We have psychotherapy groups and process groups, and also individual psychotherapy. Vet centers, as I mentioned before, they're located throughout the country. The list here is specific to New York State. This is a great resource for veterans, and sometimes is the foot in the door for veterans who might not be yet comfortable or interested in coming to the VA Medical Center. Vet centers are storefront operations, just like community-based outpatient clinics. So they're far less intimidating than the larger medical center, sometimes more accessible for veterans, and in many cases, in all cases rather, they can treat families. So families of veterans will go, possibly with or without the veteran. It's a service for combat veterans specifically. The eligibility criteria is simply to have a copy of their DD-214. So it's not as, even though our application process for the VA is pretty simplistic, but they just need to show proof of their service through a DD-214. They serve veterans with other than honorable discharges, which the VA cannot serve. The only requirement is that they had that combat service. Also veterans with military, who have experienced military sexual trauma. It's a great resource, and commonly we work with providers at the vet center, but our records are actually separate. So the VA Medical Center has a very large comprehensive medical record that as a mental health provider, I can see primary care documentation, I can see specialty care work, all of that. But a vet center provider, we can't see the work that they're doing with veterans. So it's separate, and sometimes veterans are more comfortable with that. So we always offer it as an option for our combat veterans.
That's interesting. I think I wasn't aware of that. It's possible. Vet centers are very much part of the VA system, correct?
Yes.
Okay. But it's possible to be eligible for services at a vet center and yet not be eligible for
services.
The broader VA services.
Yes.
Okay. Thank you.
Yes. So if we're working with a lot of the veterans that I see who are incarcerated, I would say, I don't want to give a specific number, but there are many who don't have good paper or an honorable general or medical discharge, but they could have combat service. So if they have an other than honorable, I like to send them to the vet centers, because there's also a veteran service officer embedded in the vet center, so they can receive treatment if they're wanting treatment, and they can also explore possibly looking into a service connection, which would give them that monthly payment if they're experiencing maybe symptoms of PTSD or other issues, depression, or a physical injury, and then also meet with the VA provider if need be. But typically, they, if they have an other than honorable, they would only be eligible for vet center services.
Okay. Now, I do know that vet centers were originally founded to help Vietnam vets, but there isn't any limitation of period of service, right? As
No.
far as, okay.
No, just the
Thank you.
combat service. Yep.
Thank you.
Yep. So just like the continuum of care with mental health treatment, we provide addiction treatment services as well. We provide outpatient treatment, substitution treatment, medically assisted treatment, medication-assisted treatment. We provide residential care. So for instance, in the Albany VA, we have an inpatient residential treatment program. It's not a locked unit, which is commonly asked of us in the justice programs. It's residential. And we also utilize a great deal of peer services. Our peer service component is crucial. It helps veterans engage in care, develop trust, work with someone who may have, had similar experiences or been in the military, and they can relate more. So we utilize those services quite a bit. Within our homeless program, we have peers. Within our vocational program, we have peers. And Jonathan mentioned earlier about CWT, our compensated work therapy program. We're able to hire veterans. They're still considered to be in treatment, but we're able to hire them within the facility and also treat them at the same time. So they can get some income, get some confidence building, skill building, and work towards maybe outside employment after they're done. So addressing issues that contribute to veterans' involvement in the criminal justice system. There are certain factors that might become relevant in working with veterans who are involved in the legal system. So the VA, again, has been very progressive in adopting some new strategies, new interventions to work with veterans who are involved in the legal system. We do neuropsychological testing in terms of evaluating maybe personality disorders or personality features. We've just recently, as of last year, many Veterans Justice Outreach Coordinators were trained in moral recognition therapy, or MRT. That works with veterans to help them enhance their decision making. It focuses on criminogenic thinking and reducing that, and hopefully reducing recidivism. It's an evidence-based approach that claims to reduce recidivism by 30%. So I'm a facilitator of that group. I have a colleague who is as well, and we run it twice a week to veterans who are in our residential treatment program. In terms of intimate partner violence, or IPV, and DWI specific issues and treatment modalities, we actually are a pilot site for an intervention called Strength at Home. It's our IPV coordinator was really motivated to get this intervention, and it's been fantastic. It's pretty much analogous to a batterer's course, or that's what is commonly referred to in the community. But we refer to it as an intervention for veterans who use violence. It's a 12-week course. It's 2 hours per class, and it's trauma-informed, very clinically based, and we've been running groups for, I think, just about a year now. Veterans that I work with who are facing maybe pending charges or have been placed on probation related to a domestic violence incident, if they're mandated, we recommend that they attend this group. Also, we have veterans, obviously, who might have pending DWIs or in the same position, maybe in a drug court, or are participating in probation or mandated probation. They go through addiction treatment services, and if they've already gone through all those hoops and they're looking to get their license back, we provide the required and credentialed services to help them in that process. Some additional specialty services. This is a picture of a veteran receiving care at a VA polytrauma center. So our recent conflicts, commonly referred to as Operation Iraqi Freedom, Operation Enduring Freedom, Operation New Dawn, OEF, OIF, or OND. there are some signature wounds that are associated with those the veterans that served in that time. So we have some specialty services to evaluate and treat traumatic brain injury, spinal cord injury, blind rehab services. There are some changing veteran demographics. Our women veteran population is on the rise. It's anticipated to continue to rise. So we've tailored our services to better accommodate women veterans. Women veteran medical clinics have been established. We've been partnering with various agencies in the community to make sure that our care is up to par and that our women veterans are treated in the same respect and professionalism that our male veterans are. So we've enhanced that. As mentioned before, our OEF, OAF, OND veterans, we have actually, it's morphed into a program called Transitional Case Management, or TCM. There were so many acronyms that we refer to it as TCM now. So veterans that are discharged who have served in country in the Middle East region or whatever countries they deem to be eligible are given 5 years of free health care post-discharge. So this TCM program is really quite helpful and provides case management services to this group of veterans. They go to outreach events and educate veterans, enroll them, and then provide them with care and navigation of our large medical system to ensure that they can be knowledgeable on what services they're eligible for, get connected, apply for service connections. In many ways, they're kind of the easy button of the system, making sure that this group of veterans is well connected. Many times they'll connect veterans to vet centers, as mentioned earlier, and they help them, understand the eligibility for the various benefits that we offer. The aging veteran, we are working much more with the aging veteran population. Our Vietnam era veterans are getting older, their needs are changing. So we are making sure that we're educating family on long-term care options, home and community-based services, nursing homes. Many of our facilities actually have nursing homes embedded within them, but there's eligibility criteria. So we like to make sure that the veterans are eligible, and also if we're able to apply for maybe a service connection that they weren't aware of, that can also change their eligibility criteria.
I just had a question about the women vets. Are you seeing, first of all, is there a significant number of women vets involved in the justice system?
I can, from my experience, I don't have a concrete number nationally, but I know from my experience it's not very many at all. And
we cover 2 women's prisons, and there's a very small amount of women that we actually work with, but there are a few. Absolutely.
That's not surprising. Now, what about maternity services? Does the VA offer maternity services?
I believe we contract out for those.
Okay.
Yeah.
Thank you.
Mm-hmm. So there's some specialty coordinators, much like actually the Veterans Justice Outreach Program position. There are some unique roles within the VA, specialty coordinators. So one is suicide prevention, obviously very much needed in terms of the statistic of veterans who commit suicide each day. This program has been in place for quite some time, and it also, the way that it works, there's a lot of outreach events that occur within the community. There's a Veterans Crisis Line, which there's locations. They had to expand, I believe, the locations from not just the Canandaigua site, but also to Atlanta. So veterans can call the crisis line if they're in crisis or in need of support. And based on their needs, if they're not hospitalized or if they are, there's a suicide prevention coordinator and case manager who follows up readily with that veteran to make sure that he or she is aware of their benefits and connected with care. There's also local recovery coordinators who are involved in helping veterans achieve wellness and integrate back into their communities. Our local recovery coordinator has a lot of influence and coordination in making sure that there's a lot of groups and interventions on our inpatient unit, and also at times working with our veterans who might struggle to engage. And we covered a bit about the TCM program or the OAF OND program, but also a specialty coordinator position.
Okay, I'm going to talk a little bit about employment preparation and placement. The VA has vocational rehabilitation, and as Courtney said earlier, compensated work therapy or CWT. The key words being compensated and therapy. And the Homeless Veterans Supported Employment Program or HVSEP. And we also have Department of Labor partnership programs. The one thing to know about the VA is about 5 years ago we had job fairs at the VA, and we had about 40 employers, organizations, agencies involved in that. The last job fair that we had over 200 employers. So the space that we have the job fairs in is growing and growing, and the number of employers and agencies involved with employing veterans is increasing astronomically. We also see a lot of veterans that are being placed in community placements, placements out in the community. The big focus is on having veterans out in the community. And a lot of the employers, for instance, Helmets to Hard Hats, Price Choppers, supermarkets, Wegman supermarkets, are actually looking for veterans with bad paper, dishonorable discharges, and that is a way that they can assist and help place veterans. They'll take any veteran, but they're actually looking for veterans that have bad paper to try to give them an opportunity to be employed.
So accessing the system and services. Veterans might access care in a variety of different ways. They might enroll and, based on their eligibility services, link in with a primary care provider or a PAC team, as we call them. They might come in through an emergency route. They might come in through the emergency room. They might come in through one of our mental health walk-in clinics, possibly in crisis or just in need of emergent services. Outpatient mental health, addiction treatment, geriatric care, family encouraging veterans to seek care. That's commonly how we find veterans getting services. The business office, or what I refer to as the Veteran Service Center, is a useful resource in our facility. It's the kind of the gateway into veterans finding out about their eligibility, bringing their DD-214 form in, or having their information scanned. I have access to a system that allows for me to know if someone, when they served, their branch of service, the time in service. But the business office or the Veteran Service Center is really the location of the VA that makes that decision, that determination. So commonly I'm working with jails and other agencies to help with the release of information. I'll talk about that in a little bit, but we need to make sure that we have the permission of the veteran to share that information. But we can, as the VJO, also be a source for case management and bringing veterans into the system. That's a lot of what we do, and I'll talk about that as well. Okay. So the veteran justice programs. The mission is to partner with the criminal justice system to identify veterans who would benefit from treatment as an alternative to incarceration. The big piece here is alternative to incarceration. The VGO will ensure access to exceptional care tailored to the individual's needs, veteran-centric, for justice-involved veterans by linking each veteran to a VA and community service that will prevent homelessness, improve social and clinical outcomes, and facilitate recovery and end veterans' cyclical contact with the criminal justice system. How we see that would be that every justice-involved veteran will have access to the health care and other benefits necessary to pursue and realize a full, meaningful life as a self-reliant, positively contributing member of society. When we started this program, how it was explained was that we cannot provide treatment to the veteran in the facility. We cannot do that. It would be a duplication of services. But we don't want to prevent them from having access and knowledge of the services that are available to them. and the services that might be used as an alternative to further incarceration. Jonathan will speak about his role within the prisons and the timeline of when his program started, which was before the Veterans Justice Outreach Program. But the Veterans Justice Outreach Program focuses on prevention. So it's a prevention-focused component of the Veterans Health Administration Homeless Program. We wanted to provide you all with a foundation of the knowledge what the VA provides, because when we're out in the community, when we're out in county jails or prisons, we're out there to educate the veteran on all of the information that we just provided you. We're clinical providers, so VJOs are commonly social workers. I'm a social worker, but I also work with, at times, there could be a VJO who's a psychologist. We're providing clinical linkage to necessary treatment alternatives for the veterans. They have to be interested in the treatment and eligible to participate. That could include mental health services, substance abuse treatment, vocational needs, housing needs, pretty much anything under that umbrella. Sometimes we meet with veterans who might not be interested or might not be eligible in maybe an alternative to incarceration, but they were never enrolled in health care. So we're enrolling them, we're getting them set up with primary care, and they have that to look forward to when they get out, which they didn't at times know that they were eligible for. The VJO programs work on an intercept model. So some folks watching might be familiar with this, may have participated in a sequential intercept mapping program within their county, which evaluates the various programs that are offered to both veterans and civilians when someone is interfacing maybe with the law. So our goal is to really mitigate the situation as early as possible. So Veterans Justice Outreach coordinators, myself, I'm out doing a lot of law enforcement education, trainings like today, to educate community partners and law enforcement on how to divert a veteran when the veteran might be in distress, might need hospitalization, might need detox, linkage to treatment. We do a lot of that. We train the New York State Troopers, we train local law enforcement through crisis intervention team trainings, a variety of means. And sometimes just quick phone calls with police officers who have questions about the resources that we have to provide. There are some veterans who might commit more significant offenses, so they are likely to go to jail, either until they can make bail or they have to stay in jail for a particular sentence. Most of the jails that I work with are asking at the booking process, have you served in the military? So I get a list of everyone who says yes to that question, pretty much sent to me every day or at least or weekly. And then it helps me to provide outreach to the veterans either telephonically, in person, or through that VA Video Connect process I showed earlier. Outreach posters are within most of the booking locations. They're throughout the jails, depending on the jail's setup or preference, so that veterans are able to self-identify and take our information. As we go further down the funnel, there are specialty courts that are established. We'll talk a little bit about those. Depending on what region you're in, you might be familiar with a veterans court or at the very least a drug court. We're very similar in that community providers go out and provide assessments to veterans or rather civilians in jails. We're that VA piece of that. I go out there and I do the assessment, provide the judge or the attorney or the drug court with treatment recommendations, and offer that as an alternative to a civilian program when it's clinically indicated. As we go further down, it deals more with sentencing, more in Jonathan's sphere as far as prisons, probation, and parole. But this is just an illustration for you, and we'll reference this throughout the remainder of the program. So, Albany County is an example I like to utilize. We've pretty much implemented successfully all of the pieces of the intercept model, as you'll see within this slide. So, starting very first with law enforcement, we've created a very good relationship with Albany City Police and Albany County Mental Health. who does a biannual crisis intervention team training. So we, myself and our VA police, who we also have a very our mental health program and our VA police, we have a good relationship with. So we provide a lot of combined trainings so that we can cover the piece related to mental health, but also speak the police language and explain that part as well. So for law enforcement, that kind of covers there. The jail sends me a docket, as mentioned earlier, and they also have a veterans pod, which is really quite helpful because depending on their categorical state within the jail, they can go on the veterans pod and they're with other veterans. They operate with a SSVF program, Soldier On, who provides peer-led services, case management, housing services. So it's a really great collaboration within that jail. The court system in Albany County, DWI Court and Drug Court, also in Albany City Court, there's something called the Vet Track. Very similar to a veterans court, but it's embedded within the already established courts that they have. So veterans are given the opportunity to work with VA. They have peer mentors who work with them throughout that process, and it's just a very supportive intervention within the court system. Probation. Albany County Probation was really supportive when we reached out a few years ago. They actually assigned one probation officer to handle all VA cases, veteran VA cases. They actually have a screening process, and they send us signed releases of information for any veteran that's coming, anyone who identifies as serving in the military, rather, coming through their pre-sentencing investigation process, and also just being assigned to probation. So we work very closely with that probation officer. I speak to her almost a few days a week, and it's really been very helpful. They also jumped aboard the VA Video Connect capability, so if we ever, it's close to us, so it's not really utilized too often, but if they ever had a veteran that was in their office and they wanted to have a conversation quickly, instead of sending the veteran all the way to our office, we can do that, which is great for the veteran. Saves them an extra trip when they already have quite a list of things that they need to do with probation. Our parole partnership is a little bit newer. What I noticed was we had veterans coming out of prison who were commonly working with Jonathan and his counterparts, and we wanted to make sure that we had a better connection with them in terms of the role that we would be playing in connecting them to care at the local medical center. So we've started to meet with them more regularly. We just recently provided a training to reentry coordinators and the heads of parole, with also some parole officers at the training academy just recently. So my hope is that those conversations will continue and that we'll be able to provide them the same services that we're providing to veterans on probation as well. There are a few limits on VA authorization. So in terms of communication that we can have, I mentioned the release of information and making sure that folks in the community have that signed when they want information about veterans that we might be working with or collaborating with together. So the VJO, in terms of our role, we provide outreach, assessment, referral, and linkage to services. We are an unbiased third party, so we're providing treatment recommendations for a veteran who has signed a release and is interested in those treatment recommendations, or at least interested in hearing of those treatment recommendations. Again, we cannot provide care in the hospital or in the facility, rather. And I did touch a little bit on here about, because this is part of my law enforcement training, but sharing of information with local law enforcement during crisis situations, there are some exemptions, but that would be really more specific if you're serving in the capacity of a police officer or law enforcement. There are some times where, as I mentioned, one of them already, where VA clinicians cannot provide care to veterans. One is if they are a patient or inmate in an institution or another government agency, and if they're a fugitive felon. So we have a fugitive felon program where someone would get enrolled in that system, and there would be a process of notifications that would notify clinicians and police that that particular veteran could not be treated. Something to note too, and Jonathan might speak to this even more down the road, but veterans who are incarcerated on felony charges, they obviously are not eligible for VA services while they're incarcerated, but their benefits, their monetary benefits, actually get reduced as well. So if a veteran is maybe 100% service-connected and they're convicted of a felony, on their 61st day of incarceration, their benefits get reduced to 10%. So a lot of what I do on the prevention side is educate veterans on that, because they might say, hey, I'm just going to take my plea deal, I'm not going to do treatment, I'm not going to take advantage of what's being offered to me. But once they find out that maybe their family won't have housing while they're incarcerated because the benefits are reduced, or they just need to be educated on apportionment because they're going to be going to prison, they can have their funds allotted to family, a majority of them, while they're incarcerated. So we do a lot of education around that, and that was something that wasn't covered in the veteran benefits portion.
Did you say reduced to 10% or by 10%?
To
10%. And if they're already at 10%, it's reduced to 5%.
Yep.
And that's only during the period of incarceration?
Correct.
Okay.
Yep. They would notify Veteran Benefits Administration of their release, and then the benefits would be reinstated after that. And sometimes, with the 10%, they can utilize the 10% for commissary. I just had a veteran who was recently incarcerated for a period of time, actually service-connected while he was incarcerated. So his 10% was utilized for commissary. He didn't have a spouse or children to apportion any other funds to. So now that he's out, he'll reapply for them to be reactivated. Okay. So we pretty much just covered that. Release of information. The VA has a very specific release of information form that I'll show you later. No custodial care. And these are some highlighted points because we work a lot with community partners. So these are a lot of the questions that are asked. Sharing information on someone without a release of information is not okay. We abide by HIPAA. No custodial care. Sometimes, someone might be incarcerated, but they had a surgery scheduled the next week. Unless they're released or bailed out, the VA is not going to provide that service while they're in the care of a county jail or prison, as they would be identified as a ward of the state, and the state would have to fund their care. There are no locked residential facilities. It's commonly asked of us. There are some more structured community programs that if a veteran is not successful in maybe our residential program, they need a little more structured care, we might seek to refer them to a community agency that can provide that level of structure. Okay. So these are some statistics on the number or percentage of veterans that are incarcerated in jails and prisons throughout the United States. In 2007, the recorded number was 9 to 10% of the population, of the jail and prison population. And the newest stats that we have, we were hoping for some more updated ones before we presented today, but the number that we have mostly is from the 2011-2012 data, which dropped down to 8%.
I can tell you that the number when the HCRV program started in 2007 of veterans that were incarcerated in DOCS facilities was exactly 9,141 veterans. And right now, as of this month, there are 2,030 veterans that are incarcerated in DOCS facilities. So it's been a huge decrease.
And from a prevention standpoint, so as Jonathan mentioned, the 2007 was around the time that HCRV began. The VJO program didn't start until around late 2009, 2010 in terms of prevention, working with veterans who had pending charges. So also in that time, so from 2007 to 2012, drug treatment courts, veterans courts exploded. There was a lot of prevention and diversion that was put in place during this time. And the number I'm going to show you next highlights the decline of veterans within the jail population. So there was a 6% decline within the prisons. but a 25% decline within local jails. And I anticipate, just judging by seeing the numbers in my area, my 18 counties kind of going down, that the next batch of statistics will show that that's even declined more from our prevention work. This is just an illustration to, again, show the decline, since the late 70s, end of Vietnam era up into present, in that reduction in the system. An additional way we offer access to veterans to VJO interaction is through veterans groups. Depending on the population or the veteran population within the jail, we facilitate groups. Some veterans are not able to participate due to protective custody. So depending on the jail, sometimes we've done 2 groups, one where it's general population of veterans, and then another group with veterans who are in protective custody. We typically open the group to all military identified folks within the jail. It's a great opportunity, much like the pods I mentioned earlier, and I'll talk about in greater detail in a moment, for veterans to interact with one another. It doesn't matter when they served, time, duration, character of discharge. It's an opportunity to sometimes even share information about benefits that the veterans might be participating in. So a veteran might not know that he or she is eligible for VA care in general, or eligible for a service-connected benefit, and we've found that to be really productive within veterans groups. We partnership with other agencies at times, so those SSVF programs that are funded by larger VA grants, we have community agencies that come with us, and they can educate them about services that they might be eligible for and how we would collaborate together to help the veteran upon release. Veterans pods are a great resource, as I mentioned earlier. It's wonderful for their interaction. In terms of Albany County Jail, I forgot to mention that we've been told that the pod essentially runs itself. They've never had any issues there. Not only are they, productive within the pod, but they're supportive to one another. And it's just a great practice. So there's a couple locations noted on this slide that utilize this practice, and nationally there's even more, but just specific to New York State, this is the information that we have. In Erie County, they actually use corrections officers with military experience, so kind of that peer piece, even though it's still a corrections officer and inmate. And, in some jails, it's more practical than others. So it really depends on the logistics of the jail and if they can do that. But it also allows for us to really collaborate with other agencies. When I go into the jail, say I have, 5 veterans that I need to meet with. And depending on their needs, the consultations can last longer, shorter. But you only have a certain window within visitation. So the pods offer you just to go in, meet with them, as you can, and you don't have to wait for them to come from the pod to the visitation area. Other veteran comes, leaves, comes back. It's just great for fluidity, time saving, and the veterans really like it. The no wrong door approach, that was part of the larger VA goal to end homelessness. So wherever a veteran might go, is it jail, community agency, we want to make sure that all of these folks are properly educated on all the services that we've covered. So if a veteran has a question, they're not maybe told no or I don't know. Instead, they're told maybe I don't know, but I know the resource that I can connect you with. So we're very big on collaboration, partnerships. Our secretary is huge on community partnerships because really we can't do it alone. We have to educate the community and connect to properly serve our veterans. This is an illustration of our VA Release of Information form. It's actually recently been updated, so that's been in just the past couple days, but there is a newer form. But this is really the golden ticket to be able to communicate between agencies. We commonly use these with a lot of jails to help verify eligibility, as I mentioned earlier. And sometimes veterans, might opt out of the interventions that we can provide and would like to maybe operate through the legal system, through their attorney's advocacy to seek a better disposition. So commonly they will ask that their records be released to their attorney. And we help with that. We make sure that we can do that. We just can't advocate in a legal advocacy role. We're not attorneys. We're advocating for treatment and recovery. So we do the best we can if there are requests outside of that, but sometimes it's commonly referring to the attorneys. The next form is a copy of the DD-214 form, or military discharge paperwork. This is a SF-180 form that we utilize quite commonly to help veterans access not only their military discharge paperwork, their DD-214, but also personnel records if they want to seek an upgrade in discharge or seek a service connection, so they need their medical paperwork. We do that a lot. We're asking the National Personnel Records Center to send it, so sometimes it can take some time, but we make sure that it's either sent to us or a veteran's family member if it might be that the veteran is going to be getting released. This is a copy of the poster that we noted in the intercept model earlier. This is the poster that's put in most of the correctional facilities, pods, dormitories, and it includes all of our upstate contacts. So sometimes we have veterans that are housed in from out of our catchment area. So I mentioned I cover the 18 counties around Albany. Sometimes we have veterans who are from Jefferson County or Dutchess County, which is technically out of our catchment area, but housed in Albany County Jail. So we still meet with those veterans, and we coordinate with our VJO colleague in the other catchment area to make sure that they have all the updated information. Sometimes our colleagues have already met with them, so we just do continuity of care, checking in, making sure that all their questions are answered, if they need documents, all of that. So we just make sure it's a seamless approach to the care that we provide. This is a resource card. So I mentioned we do a lot of law enforcement education. In 2012, I was sent to Atlanta to do a train the trainer exercise. We eventually trained all of our VA police in a mental health, pretty much like a crisis team training, advanced mental health training. So one of the pieces of that was that we would come up with a resource card for our community law enforcement. One side illustrating how to interact or ask certain questions during a veteran encounter. So questions like, have you served in the military? What branch? Do you need housing? Things like that. That might not come as easily to a civilian law enforcement officer. And then on the other side, we included not just the VA police information, but also our clinical programs and also our vet center and our crisis hotline. Sometimes what I commonly tell folks is, if a veteran is struggling and maybe not yet ready to engage in care, or maybe not yet ready to even engage in care if they have pending legal, sometimes their family likes to have a resource. So the crisis hotline, we make sure that everyone is aware of that. But it includes our substance abuse program, homeless program, our walk-in clinic for mental health needs. Now this is Albany's card, as you'll see. There are cards specific to each catchment area. So my colleagues in Syracuse, Buffalo, Canandaigua, downstate, they all have a specific card that they hand out to their law enforcement within their catchment area. We found these to be very, very helpful. We even give them to clinicians, community providers, because sometimes they're just calling the general line at the VA, and it's much easier to have that direct line. So it's a good resource. These are the VJO contacts within New York State for you to, there's email included. You might be familiar with them already, but that's your go-to depending on where you're located.
Okay, so I'm going to talk a little bit about the HCRV, or Healthcare for Reentry Veterans Program. There are 3 people that cover the entire state of New York. I cover the upstate region, the whole right-hand quadrant of New York State, out to Syracuse, up to Watertown, the Adirondacks, and the Upper Hudson Valley. We have another person named Cynthia Thayer who covers Western New York, the Finger Lakes region, Niagara area, etc. And then we have a third person named Valerie Johnson who covers the downstate area. She also covers Lower Hudson Valley, New York City, Long Island, and northern New Jersey. Okay, so the program goals for HCRV are the following. So we try to optimize veterans' chances for successful community reintegration and readjustment through comprehensive psychosocial services and transition planning. This means to decrease the veteran's potential for relapse into substance abuse and decrease the veteran's potential for mental health problems. We try to target behaviors and attitudes that can lead to additional criminal actions and reincarceration. And as Courtney said earlier, some of what we use is the moral recognition therapy, or MRT. So some of our objectives are to conduct outreach to veterans in DOCS facilities, DOCS being the Department of Corrections and Community Supervision, who are within 6 months of their earliest possible release date. And so I visit every DOCS facility in my catchment area, which are actually 23 DOCS facilities, at least twice a year. Some of the facilities have what they call veterans dormitories that have more veterans in them than some of the other facilities. For an example would be Governor Correctional Facility, and I will be going there actually next week. They have 51 veterans who are going to be released within the next 6 months. We try to educate veterans about services and options available to them through the VA. So it's a psychoeducational program. We collaborate with veterans, DOCS. Every DOCS facility has a veterans liaison that we work with. And we also collaborate with parole around pre-release planning. We also provide short-term case management for veterans that have been released. By short-term, I mean 4 months or so. Some veterans choose not to accept case management or don't ask for case management, but many do, and we try to follow them and provide as much as we can, answer questions about reentry as they come up. So this is what the HCRV program can do. We can guarantee a screening for many of the programs and services after release. We can provide documentation to the parole board that the veteran has been assessed, and we can recommend a reentry plan. So we work pretty closely with parole, and we can provide referrals to appropriate VA and community programs. For instance, if the veteran isn't eligible for VA or is only eligible for certain VA programs and needs the support of additional community programs, we can provide those referrals as well. And this is what we cannot do. We cannot provide medical, and we get this question all the time, we cannot provide medical or mental health treatment while the veteran is incarcerated. So the VA can't come into the prisons and provide medical or mental health care because they are considered a ward of the state, of New York State. We cannot guarantee admission to specific programs before the veteran is released. So we can guarantee a screening, but we can't guarantee that they're definitely going to be admitted to the program. And we cannot overcome barriers to services as a result of a history of either a sexual offense or arson. And that's based on New York State law. That's not based on VA rules, but it's based on following the rules of New York State. Okay, so community collaboration. There are 20 county reentry task forces in New York State. For those of you who don't know what those are, they are a conglomeration of human service agencies, government agencies, all different types of organizations, including faith-based organizations, that come together in what they call impact counties, which are counties where the most amount of parolees are returning to that county. So for instance, in the Capital District, it might be Rensselaer County, Albany County, Schenectady County. In the central New York, it would be Onondaga and Oneida County. In western New York, Niagara County, Monroe County, Erie County. Downstate would be Orange County, Rockland County, Westchester County, the Bronx, New York, and Nassau County. I don't know if I got all 20, but I got close. HCRV works very closely with reentry task forces to identify reentry veterans. So the task forces will alert myself that there are veterans that are coming back when they receive reports through DCJS. And also the VA ineligible veterans receive assistance from the community agencies that are involved in the task forces. So we generally try to provide some type of service for veterans, but if they're not eligible for certain types of services at the VA, we make sure that we link them up with agencies, community agencies that will provide services for them. And we help to facilitate the transition to community resources. And that could include anything from employment to finding food banks to any kind of resource that a reentering veteran might need. Okay, so I talked about this a little bit earlier, but in terms of the veterans that are in custody in New York State. So this is as of October 2017, this past October. According to docs, there were 2,043 veterans in New York State prisons as of October 2017. We get a readout or a printout from docs every month about how many veterans are incarcerated in New York State. We actually get a readout of how many veterans are in each particular facility. So we know where they're coming from. Obviously, the veterans' dormitories are going to have more veterans in them. For those of you that don't know, the veterans' dormitories are located at Groveland Correctional Facility, Gouverneur Correctional Facility, and Mid-State Correctional Facility. Okay, so there's a big collaboration, obviously, between VJO and HCRV. And we collaborate on assessing veterans in county jails for diversion to veteran treatment courts, or for reentry services for veterans within 6 months of release from incarceration.
Could I ask, how does DOCS identify them as veterans? Do they require documentation, or is it self-certification, or?
Yeah, that's a great question. So there's two ways they do that. Upon when they're initially incarcerated, they actually have the vets apply for, or anybody that claims to be a veteran apply for DD-214. And so they're there right at the beginning. But if there's a question about it, they also have a program that they do through the VA called VRSS, Veterans Reentry Search Services. And that's a way to kind of cross-check between the DOC system and the DOD as to whether or not they have any type of military service. And the reason we do that is there are a number of veterans that may say they're not a veteran and they actually are a veteran, or they don't think that because they weren't in wartime or they don't have a particular amount of service or whatever that they're not actually a veteran, when actually they are. So that's a great question.
That's a problem within the addiction system. They either don't identify themselves, and then there is a much smaller subset that says they are and they're not. So I'm just curious.
There is that too, yes.
We've, Jonathan and I have worked in more collaboration recently with veterans, as I mentioned earlier, with the parole piece. So veterans that are coming out, if he's meeting with someone and kind of finding out that they're coming to my catchment area, he'll alert me so that I'm kind of within that process. And at times, so on occasion, I can't remember the exact number, it might be around 4 or 5 veterans that we've successfully housed successfully housed and set up with primary care as well as substance abuse treatment by doing a telephonic screening before they get out, just like we would do with interventions in the jail. And that's been great. Parole has been on board. We're able to use those contract beds or grant and per diem beds that we spoke about earlier to go right bed to bed. And that's been successful. We're hoping to do more of that.
So the numbers that are reported to you are those individuals who have been documented as veterans regardless of discharge status, or do they have to meet certain discharge criteria?
No, it's regardless of discharge status.
Okay,
Yes.
Thank you.
Okay, so the 4 pillars of the HCRV program are basically education, assessment, as we talked about, and the assessment we do in the facility when they're within 6 months of release, and then linkage, as Courtney just talked about, linkage and referral. Where's the veteran going to be going to? What's the most appropriate place, and who can help the veteran the most? There might be several different agencies involved. And so collaboration outcomes can include an increase in outreach activities, which is definitely happening now. Increased community partnerships. When the reentry task forces started, there were 7. Now there are 20. So you can see through that their community partnerships are growing quite a bit. Increase in reentry veterans engaging or re-engaging with the VA. Recently we've done some studies about, and this is across the country. By the way, there's a reentry coordinator, at least one in every single state, and sometimes 2 or 3. Like California has 5, but depending on the size of the state. And so we see an increase in reentry veterans engaging or re-engaging with the VA. Increased housing placements through the domiciliaries, as I talked about earlier. Emergency contract housing, the grant and per diem or transitional housing, and our permanent housing or HUD-VASH. And the bottom line is reduced recidivism among veterans. And that's what we're seeing quite a bit. And DOCS is very happy to see that as well, not just because they're veterans, but for those of you that don't know, what DOCS tells us is it costs about, for every veteran that's incarcerated, or every individual that's incarcerated in New York State, about $60,000 a year to have that person incarcerated. And while they're incarcerated, obviously they're not paying taxes or working, if they're eligible for that. And if they owe child support, that's not happening either. So the difference, it could be up to $70,000 of the person being out of the correctional facility versus being incarcerated. DOCS does not want them incarcerated unless they feel that they're a threat to public safety, in which case it would cost more, theoretically, for them to be outside of the prison system.
And our roles are very unique based on our jurisdiction. So my particular catchment area doesn't have a great deal of veterans courts. However, as you go towards the western part of the state or even down in the city, there are more veterans courts. So the role of the VJO in those areas is different. They might be more active in a veterans treatment court, might be in veterans treatment courts all the time. Because I don't have that, I'm actually doing a lot of work in the jails, which, and actually some catchment areas have more than one VJO, so to tend to the courts at times and also to do the jail outreach. And I think the same applies for the reentry positions, just based on the nature of your jurisdiction. So we spoke about our particular areas, but it can be very different across the area.
Absolutely. Yeah.
I just have one final question, Courtney and Jonathan. I know that in recent years the VA has gotten very interested and has mounted some efforts at implementing peer programs. I believe they have peer specialists now in a lot of facilities. Do you utilize peer specialists at all in your work?
I, within the Veterans Justice Outreach Program, I don't, like in terms of veterans coming to the jail or peer services coming to the jail to meet with veterans, I have not utilized. However, within the context of the treatment that I provide, so through MRT, doing work with veterans who are involved in drug treatment court, veterans tracks, things like that, I heavily utilize the peer services. Okay. They're embedded in our team and a vital resource.
And I utilize the peer support in terms of homeless services because a lot of the reentry vets can relate to others who have gone through a similar situation, and also with vocational services. And we have, in a number of cases, we have peer services through job coaching, where the veterans have another veteran who maybe came through reentry or came through a period of homelessness and serves as a job coach for the veterans out in the community.
Okay, thank you. Are you familiar with a program called TASK?
Yes.
You must be. Great program. Great program. Well, I guess that wraps it up. And I'd like to thank Courtney Slade and Jonathan Pollack for their work today. Once again, the VA has come through for OASAS, as they have ever since I took this job about 10 years ago. And we really appreciate their expertise and their knowledge. And it's a tough job they have. I know they take a lot of heat in the press, but it's a tough job. So by the time you see this, Veterans Day will have passed on the calendar, but every day is really Veterans Day. So please, when you meet one, thank him or her and say welcome home. And that's it, folks. I hope you enjoyed this presentation of Learning Thursdays. Thank you.
So, to follow up Paul and his thank yous, I would like to express some thanks today as well. First and foremost to Paul Noonan, our Veterans Liaison, who does a lot of work to ensure that every November we have a presentation that totally focuses on the veteran population, especially as they've been an underserved population in our field in the past. So again, Paul, thank you for that. And there are times where Paul is able to bring us a second presentation with the focus on veterans as well. And to our two presenters today, not only do I want to thank you for volunteering your time and your expertise for this presentation, also for doing the work you do, because you two are working with a population, as I have said before, has often been underserved and a little bit neglected. So thank you for that. And finally, we have to thank Jerry and Dan, because they are the people who are behind the scenes throughout this whole presentation, who will make sure that the presentation you are watching is as professionally refined as it can be. So to Jerry and Dan and Media Services, I want to thank you. And finally, thank all of you for joining us today. I want to make you aware there will be another presentation at the end of this month. It will be the 11th out of 12 Year in Ethics presentations. So I will see you again at the end of the month. In the interim, as you know, as you can read, as I stress every time, your feedback is appreciated and it's important. It's the only way for us to know that we are meeting your needs both professionally and educationally. So if you can do us a favor and take a moment to complete the SurveyMonkey, that would be helpful as we go forward in bringing presentations to you. All that being said, again, thank you for joining us and enjoy your day. Bye now.